How are you? Once again, welcome back. So,
Hello, welcome back to the Book of Perfume. I'm good, and yes, my dear Mr.
so we
Yuval
got
Riyad,
the question from a user named Fan of Movies.
fan of Zuma is my
Yeah. So
follower. Yes, I
according to
know.
his question, he asked about the causes of ear embolism
Mm-hmm.
after going on bypass,
Okay,
and even pre-bypass checklist are done. So what?
by the
Yeah,
perfusionist, and
yeah.
still there
So
is
what will
a
be the possible cause?
okay. First of all, thank you so much for the great question by fan of movie. We already discussed last time about the air embolism, and as we discussed, I'll just go through with the and then it's going to be on a topic. So, air embolism, if there is air in our coronaries or in the brains, there is a chance of organ to be damaged, and it can be a life threatening. And as I mentioned in my previous video, that always do your pre checklist to prevent from the air embolism during the cardiopulmonary bypass. And as per the question by the fan of movie, that although they go through with the according to the checklist and still by any disaster, any volatile situation, air enter into the patients through the circuits. So what can be the causes of going entering the air into the systems? This is the question.
Yeah.
So I try to make in points. So the first point of air, the cause of air is in the circuit is like air entrapment in the venous line. Okay,
Mm-mm.
first I'll read and then we're going to discuss. So
Okay.
first point is air entrapped in the venous line.
Mm-mm.
Second cause can be the inadequate de-airing of the heart.
Mm.
Third is open or leaking connectors. Fourth is your cardiotomy suction. Fifth is your oxygenator malfunctioning. Sixth is the negative pressure in the venous reservoir. Seventh is a rapid priming or a repriming of the circuit. Eighth is the air entered during the cannulation or decannulation. Ninth is the aortic root venting malfunctioning. So I'll go one by one. So these are the nine actually causes,
Mm.
the causes of the air embolism
Embolism.
during the cardiopulmonary bypass. So first we'll talk about the air entrapment in the venous line. So air entrapment in the venous line can be the improper priming of your venous line, and we are suctioning the air, and there's a chattering in the venous line. And number two, there is some connectors cracked, or tubing get cracked, or cannula dislodgement and the cannula get cracked due to some minor reason, then there is a chance of air entrapped in the venous line. Number two is inadequate de-airing of the heart, and especially when we do the aortic root venting and before releasing the aortic cross clamp, if you didn't do the proper venting of the heart, there is a chance of air in the coronaries, which can lead organ dysfunctions like air embolism, and the heart will going to lose the function of the hits of the heart. Third one is open or leaking connections, like sometime you have the central venous lines, or which is you kept open and the airs enter through the venous system into the reservoir. Sometimes the arterial a lines, your ports is opening, and there is a chance of entering of the air into the circulatory systems, and there is a loss of your aortic cannulas connections can create a air in the circuit, and opening and leaking of the connectors, and sometimes your aortic cannulas connectors are cracked or leak, and is not properly primed, and it can be a cause of air embolism. Third, we talk about the cardiotomy suctionings in some of the procedure where you require a vacuum venous assist drainage, and it will over pressurize your cardiotomy suctioning. There is a cardiotomy suctioning can create a air embolism. Oxygenator malfunction is one of the reason of and the cause of air in air embolisms, because some of the oxygenators having malfunctioning, and there is a leakages in between heat exchanger and a heat exchanger membrane oxygenator, which can cause air embolism and air enter into the system of the patient, in arterial system of the patients. Then we have the negative pressure in the venous reservoir. As I already mentioned, excessive negative pressure creating uh, there is a chance of air embolism due to the high negative pressure in cardiopulmonary reservoir, which can lead to suck air into the membrane, from the membrane go into the patient. So this is the can be the cause of your air embolism. And then we have the rapid priming. So you primed your circuit very fast, and or sometimes you need to reprime the circuit, and you can enter the air during the priming, and it will going to enter to the patient. When you're going to hook and connect it your circuit with the aortic line or the venous line, that give you, there is a chance you can push air into the system, and there is a chance of air embolism. Then we have the aortic root venting malfunctioning. Sometime your root vent was not connected properly. The direction of the root vent is the opposite side. So instead of sucking the volume from the corner, you are pushing the air into the coronaries. So there is a different causes, and we already highlighted 9 causes which can create a which can cause air embolism during the cardiopulmonary bypass. So what are the high risk moments of the air embolism during the cardiopulmonary bypass? It is, we have the 4 high risk moment for the air embolism during the cardiopulmonary bypass. Number 1 is the time when you initiate the bypass. That can be the time when you can push air into the system, into the patient, in the arterial system of the patient. Number 2, the time of you when you're releasing the cross clamp and you didn't de-air properly, there's a chance of air in the circuit. Number 3, the time of de-airing and maneuver you're taking to manipulating of the heart, there is a chance of you can push air into the system, into the circuit. And number 4 is the time of termination of the bypass. So the 4 moments are very crucial and very important as a professional, that where you have to take care of the patient to keep the air, avoid the air enter into the circuit. One is at the time of the cannulation, number 2 is the time of cross clamp removal, and number 3 is the time of de-air and maneuver of the heart, and the 4th one is with the time of when you terminate or wean off the bypass from the circuit. So this is the causes as per fan of movies questions. So this is the 9/10 causes which I already explained to you, to can create a air circuit, air into the circuit, and can cause a air embolism during the cardiopulmonary bypass. So now once the air enter to the patients, now we have to think about what if you have to do once the air entered into the patient. So I already tried to make some few points, and I'll try to discuss with you. So first is once the air enter in the circuit, you have to stop your pump, you have to stop the entry of the pump, and you need to find out the cause of air entering. So you have to class the vehicle, clamp the venous line, inform to the team that I'm going to stop because of the air in the circuit. Then you have to find the reason for and find the causes of air entering. So you have to resolve that issue. Number 2, then you have to check the source of the air entering back. As I mentioned, you have to check your cannulas, connectors, oxygenators, pump head. Inform to the team, as I already mentioned, immediately. Then you have to position the patients, like a patient normally is in a supine position, then you have to make it in a Trendelenburg position, mean your head should be in the lower and the leg should be in the up, so to avoid to enter the air into the brain side. And as from the surgeon side, they will going to fill the surgical field with the water, and they will try to use the CO2 displace air from the operating field. Then you have to aspirate the air. So how you are going to remove the air from the circuit? You can use a aortic root vent, LA or LV vent, and the pulmonary veins can be used for as a venting, and the coronary ostia can be used to as a, if it is applicable, to remove the air from the circuit. And the 4th is you can use the RCP, retrograde coronary, retrograde cerebral perfusion is one is the method of removing air from the circuit. And If you are using the same cannula in the same aortic root, then you and keeping the venting on, then you have to increase your mean artery pressure to like a 70 to 80 or 80 to 100 millimeter mercury, and pump flow increase, and reinitiate the augmented cardiopulmonary bypass, and consider try to reduce your hypothermia to 22 to 32 to 28 degree in Celsius. Don't try to warm the patient, because if you are going to warm the patient, try to avoid the warming the patient until you remove the air from the circuit. Okay, and we'll talk about the RPC, RCP after later on. The major point is your neurological protection of your brain. So you have to give a mannitol or a hypertonic saline in your circuit, which is going to help to reduce the cerebral edema. From anesthesia point of view, they will going to give dexamethasone, or they give the thiopentin for the cerebral protections. They are going to monitor the EEG, or you can use the cerebral oxygens to keep the saturation above than the 50, move on the both side. And the post-op, you can use the hyperbaric oxygen therapy, and use the nitrogen to wash out and reduce the bubbles in the blood. And the post-operative, try to do the imaging and monitoring the preventing measures. So to doing all to remove the air from the circuit, always apply your hospital protocol, dearing protocols. Always keep a bubble sensor on the circuit, keep the level sensor on the reservoir, ensure the correct cannula positioning, keep the CO2 flush, especially in a valve cases, CO2 flush circuit before priming the your circuit. So these are the few steps you have to take if the air enter in the circuit and if the air embolism happen. And the one most important part is sometimes the surgeons do the retrograde cerebral perfusion, say they remove the aortic cannula and insert the aortic cannula into the SVC, and they run a pump retrogradely with the flow of 2 to 400 mils per minute, and with the pressure of 20 to 25 to 45 millimeter mercury for at least 20 to 30 minutes, and make sure once your air removed, and then you initiate a regular bypass for the surgeries. So guys, hope you got your answer from fan of movie. And if you like the my video, please share and comments, and I'm happy to listen question from you, and I am happy to share my experience among you. And I'm so happy that at least you get something beneficial from my life, from my side. And keep watching, and keep commenting, and keep encouraging to me. Have a nice and good day. Take care. Bye bye.